RPG Life. Moving on then, Max Healthcare has formally inaugurated its super speciality hospital in Dwarka, which will have a capacity of 300 beds. And our colleague Parikshit caught up with Max Healthcare CMD Abhay Soi and began by asking about this facility and their expansion plans. Listen in.
With this bed capacity expansion of 300 beds at present, we will be touching 5,100 beds across the country. This is our 25th year for Max Healthcare, and we've decided to celebrate it with 4 commissionings this year. First of which was yesterday was the Max Dwarka Hospital. And we look forward to the 3 other commissionings which are on our way. One will be at Max Saket, which is right in the center heart of our hub, which is in Delhi. Another is going to be in Nanavati, Mumbai, where we're expanding late in the year, as well as Mohali, Punjab. So exciting year for us. We are increasing capacity by close to 30%.
Right. As you said, this is your 25th year. Could you also outline some other growth plans for us, your own vision for the company over the next 5 years?
So I think there is tremendous amount of asset creation which is required. As our country is sort of progressing, we are going towards being a $5 trillion economy. The aspirations of people, the desire for quality healthcare, on one side is increasing. On the other hand, the population, the baby boomer population is becoming a year older, is likely to be a little more sicker as years go along. And we require quality healthcare. So I think really for us, it is, we are focusing on building quality healthcare assets. We have added 30% capacity last year, largely through acquisitions, but in the current year, we're expanding it by another 30%. And getting to 5,100, and by the end of 2028 we should have another 3,000, close to 3,000 beds established, and this is what we're constructing at present. So we should be close to 8,000 beds, and the idea is really to keep reinvesting the capital that we are generating in order to create the quality healthcare assets that are so required in the country.
Right. I would also like to ask you about your capex plans. Last year in November, you had announced, you had said that you would be investing about 6,000 crores over the next 3 to 4 years. Could you give us the capex plans, the expansion plans for FY26 and overall till 2028?
So like I mentioned, we will be adding 30% more capacity, which is close to about 1,500 beds in the current year itself. Up till 2028, it was going to be another close to 2,000 beds. So that makes it about 3,500 beds total. This will be at a cost of about 6 to 6,500 crores, and almost entirely through internal accruals. We will be at the same time be focusing on inorganic growth through acquisitions as well. I mean, we have a very low amount of gearing in our balance sheet of about 0.5 or 0.6 times debt to EBITDA. So that gives us enough headroom to acquire as well as build more.
Right. Are there more acquisitions, strategic acquisitions on the cards for this year?
Absolutely, and we're looking forward to some.
Okay. And could you give us a sense of the kind of cities where you would like to acquire such hospitals?
So we've been very clear about 2 things, that we have 2 requirements. One is we don't like to go into uncharted territories. We prefer territories where at least 1 or 2 of our peers have proven viability over a period of time. So these become uncharted territories for us. And the second is we seek a 20 to 25% ROCE over a period of time. We are currently operating at ROCE of about 35-36%. We seek a ROCE of about 20 to 25%. So long as any acquisition or a new build, both these conditions suffice, we're happy to sort of go in there.
Right. Also, if we were to ask you about where is the highest growth for Max Healthcare coming from at this juncture and for FY26, could you give us a sense of the geographies, the cities which would be contributing to the highest growth?
Well, we have a massive amount of capacity in metro cities, about more than 80% of our total capacity is in metros, but we are seeing significant growth in non-metros as well. places that we've recently done acquisitions, such as Lucknow, Nagpur. We've seen almost a 4x increase in our profitability over there. Some amount of it may be to do with the latent demand and the cities being underserviced, but another part is perhaps to do with the efficiencies that we've been able to sort of lend to these assets.
Okay. If we were also to ask you about other healthcare segments, you're of course talking about the bed capacity expansion, the strategic acquisitions in the hospital sector, but within healthcare, in terms of digital delivery of services, digitization, more digital apps, increasing your digital offerings, are there some plans on the cards in terms of focusing on other segments in healthcare?
So we already have the digital app part aids our delivery system, and in sort of services and supports us our present patients. And we've had that app now close to 24 to 25% of our total business is through digital sources. What I mean is you don't deliver healthcare through it, but your bookings and so on and so forth are done through digital sources. So the world is moving towards that. Secondly, I think there are other very exciting verticals as well in terms of home care. That's a business which we have the largest sort of home care business in the country, perhaps the only profitable one. It's been growing at 25% CAGR. Our diagnostic business, again, has been growing at a 25% CAGR for many years, although it's a small percentage of our total overall revenues, but we see a lot of excitement in both these sort of verticals as well.
Right. Mr. Soi, we have been reading reports how almost 600 private hospitals, according to the IMA, have stopped treating patients under the Ayushman Bharat health insurance scheme. We also see that many private hospitals have not yet come on board with the scheme. Could you give us a sense of what are some of the issues or hurdles that you see with the scheme right now and how it could be made better?
I think, with respect to private hospitals, particularly in the larger cities, the cost of, in metros, the cost of, manpower, our cost of fuel, our cost of land resources, and so on and so forth, are significantly higher than non-metro cities. So it's not necessarily viable for players like us to sort of participate in Ayushman Bharat from that standpoint. But I think, we have been working with the government how to sort of come up with more features in the policy, perhaps, which would be, then we will be able to accommodate those.
Right. Could you give us a sense of the features some suggestions that you've made?
I think one is to do with pricing. Second is to do with, our ability to use certain medicines versus, more generic medicines versus branded medicines and so on and so forth. So you'll have to reverse engineer the costs because I think effectively what is happening, the cost structure doesn't sort of work out for even from a standpoint of any contribution towards fixed costs. We are unable to cover variable costs. So that's where the problem lies.
Okay, so that's the management of Max Healthcare talking about their new hospital that they've opened in Dwarka and separately providing guidance with regards to how they are seeing growth pan out in a lot of their verticals. We'll take a short break on that note, but Sachidanand Uttikar of Trade Bulls will join in with some trading strategies. Stay tuned.